Sir. Good afternoon. We're here for the Mayor's budget hearing for social services this afternoon. I'm joined by the Finance Director, Ms. Talia Lomax O'Neill, and the City's Chief Strategy Officer, Brian Kelsey. I also see Council Lady Taneka Vircher, Chair of Budget and Finance, who's here, as she has been all week. Real trooper on that one. Before we begin, I've got just a brief opening I'd give. As you know, for the last couple of years, we've had significant increases in revenue as a city. This year, we're not likely to have the same increase. So the finance department has communicated that we're essentially a status quo budget this year. By doing that, we can continue to live within the current tax rate, which is historically low, and continue to provide the current level of service that we're providing to the community. So that's where we're starting right now. If you could introduce yourself and those who are with you today, and then give us a brief statement about your department and such. We'll probably have some questions at the end.
Thank you.
Thank you.
Opportunity to be with you today. I'm Renee Pratt, Executive Director of Metro Social Services. To my left is our Chief Financial Officer, Lisa Ricketts, and to my right is Judy Tackett, the Director of the Homelessness Commission. Metro Social Services provides a range of services to help Davidson County residents who are in need. These services promote positive change for individuals and families in times of crisis and economic hardship. Over the past few years, with an increase in funding, we were able to assist families and individuals experiencing homelessness with permanent housing with assistance of case management and financial support. Considering the fact that children under the age of 18 experience the highest rate of poverty, over the past 3 years, we consistently increased the numbers of families placed in permanent housing through the HEROES program. The HEROES program is the in-school program for homeless children. This program, along with case management, also prevents school reassignments during the academic year. According to the information in the Metro Social Services Community Needs Evaluation that I've brought you a copy of today, the primary causes of hunger in Davidson County are low wages, high housing cost, and poverty. We are also aware that 20% of people 65 years and older, Social Security is their only source of income, which limits their resources for food. Given this information, we have consistently increased the numbers of individuals and families we serve in our nutrition program. We are the largest home-delivered meal program in the county, and we have 15 congregate meal sites in the city. We created a 50 to 59 meal program for baby boomers, a family meal voucher program, and we also provide inclement weather emergency meals for our customers. Last month, we released our 9th annual Metro Social Services Community Needs Evaluation. The needs evaluation contains social, socioeconomic, demographic, census data, and information about unmet needs in the areas of aging and disability, food and nutrition, health and human development, housing and neighborhoods, and workforce and economic opportunity. The data has authenticated the magnitude and depth of poverty in Nashville, and particularly in predominantly African American communities. Nonprofits indicate that they use the community needs data to seek grants and funding opportunities. This in turn brings additional resources into our communities. The primary use of the needs evaluation for social services is to objectively profile financially struggling households and to allow us to prioritize the use of our limited resources so that we can maximize the impact of those who are most in need. With the prioritization, we decided to adopt the new two-generation approach model addressing the needs of parents and children so that we can move families to economic security. Last year, we produced a document called Know Your Community, and Mayor, I think you hosted our first event for the release of that document last year. This document contains 25 data points for 35 council districts. We received favorable response from this document, and we will enhance this year's information by including comparable data for the districts. Over the past few years, Metro Social Services worked with the Office of Emergency Management and other Metro departments to open the Metro Overflow Shelter. This year, Metro Social Services was primarily responsible for complete operation of the shelter. The shelter was open for 23 days, almost double the number of days the shelter was open last year. We hosted 150 to 200 individuals each night. Social Services will continue to open the shelter at 25 degrees this winter. The Homelessness Commission asked to form a committee to look at extreme weather for the city. The role of this committee is to develop a solid recommendation and report back to the Homelessness Commission on how the city should address the exposure of risk and the elements for literally homeless people. Now, I would like to yield the rest of my time to the Director of the Homelessness Commission, Judy Tackett, that will provide you with information on the Homelessness Management Information System. Thank you.
Thank you so much, and thank you for having me here. I want to acknowledge two of the commissioners that are here, Council Lady Tanaka Vercher and also Charlie Strobel, and show that report, and also some of my team members. So thank you so much for being here for the support. The goal today for me, what I want to talk about is where we are as a city and where we need to be to build an effective housing crisis resolution system, and why, and what we intend to do immediately to move us towards that goal. But first, I would really want to acknowledge that we heard the status quo budget request, and you still see a request in front of you, but we're already looking at the current budget to see what we can do within it, where we can find the funding. We have right now $1.9 million in funding. A little over $1 million of that goes towards grants for Rumini, Park Center, and Centerstone. And we are really a lean office, so we need to look at the services and everything. And even beyond that, we look at other options. So I just wanted to have that out there to begin with. But the budget request is really looking at where do we need to be as a city to build, and with our community partners, build up on what service providers have been doing for years already. They have provided services, they have assisted people. Where do we get to the next level to be accountable to ourselves and with each other as a community on moving people to housing as quickly as we can? I really looked at where we are as Nashville as a community. We are here, the peer cities are here, and the budget request is where we need to get to. So that's a vision. If it happens this year, if it happens next year, whenever it happens, that's what I think needs to happen. More specifically, we looked at Memphis and Louisville and looked at what federal funding. They're comparable in just the population size to our city. We looked at the funding that they get through the federal grants. Overall, their funding award is Memphis $6.7 million, Louisville 3 times $9.5 million. Our funding is $3.2 million. When we look at these federal fundings, they're extremely competitive, and the federal government is giving funding to cities that can show the progress. Our homeless management information system, which is the database that the federal government requires jurisdictions to implement and show that and capture that progress, is just not, we have not invested as a community enough in it to get us to the point where we are competitive. Also, comparison on that, Nashville, the federal dollars that we put into the HMS funding in Nashville is about $53,000. In Memphis, that's 5 times more. In Louisville, that's 4 times more. And the overall budget in Memphis is $400,000 in our system. The commission has actually increased. We're already paying for our database out of the commission budget. We increased it last year from $27,000 for years and years and years. That's all we ran it on to $53,000. To really get to where we need is we need a 4-member staff. We need an investment to really get up to a budget, an annual budget of $200,000 to make that shift. There's some technical assistance that are put in there as well, but it's really looking at a whole staffing model that is able to respond and have immediate response to what the people's needs are out there. So this is all a little theoretical, so I really wanted to. Last year, we went for a PIP, a partnership with MTA, to provide up to 500 annual bus passes to people who experience long-term homelessness and have a disability. And as part of that, the way we built that system up is we want a partnership between housing navigators. Housing navigators in the city are trained by the Homelessness Commission. It is really to create a standardized process, so wherever people are working with a housing navigator, it doesn't matter which provider it is, it's the same type of services that they receive. And through this bus program, it's the housing navigator that actually applies for the bus passes. People are entered into the HMIS system, into the database, the common database, and one of the requirements is that the partnership between the client and housing navigators, they have to be in touch with each other for every 2 weeks just to work towards housing. That is the goal of this entire program. It started in October. To date, we just checked on Tuesday, 253 bus passes are out there. 253 people have the bus passes. A third of them is in permanent housing. They are not getting them when they're in permanent housing. It's really people, and then also the database shows us 93% are meeting the chronic definition. They have been homeless for a year or longer. So I was really very positive about the outcome that we can show. I'm really proud of that. I'm really proud of my team that really is monitoring this. I'm proud of the partners because it's up to our collaborative spirit in this community to make this happen. And I feel with this database we already showed that what we can do and show and be accountable to each other. With that, I really want to open it up to questions and see where you want to go.
Can you just elaborate, what's the eligibility for the bus passes? How does, just for the general public
Yes.
to know,
Yes.
how does somebody become eligible for those passes?
A person has to be willing to work towards housing and work actively with a housing navigator. A housing navigator is a social worker, an outreach worker, a case manager at any of the partner organizations in the community, at a nonprofit or a government agency. And they have to have a disabling condition, which means it could be mental health, it could be substance use, it could be both, it could be physical disability, and they have long-term homelessness. We're looking at 5 months or more. Okay. The goal is really to focus on some of the most vulnerable people out there and work with them intensely to get them in housing.
Okay. And I just would like to thank you for following the guidelines regarding status quo submissions. I do know that the only requested here are to permanently establish funding for some of the PIPs that have already been approved to move forward, other than the consideration for the HMIS system. And I know that has been a challenge for many, many years, and you're just trying to move the needle on that.
Yeah.
Okay, so thank you.
Judy, could you explain a little bit more background about the HMIS system to provide some additional context here? So who primarily has the responsibility for maintaining that database today?
Yes. I'm going into really explaining a lot of terms. So the continuum of care is a federal construct from the Department of Housing and Urban Development. There are about over 400 jurisdictions. Davidson County, Nashville is considered, it's 3 things. It's a geographic area, it's all the stakeholders within that geographic area, and it is also a funding source. That's the $3.2 million that we get thereabouts every year. So the continuum of care selects a HMIS lead and a COC lead, a collaborative applicant, that's what they're called. Right now, MDHA is taking that role, both those roles.
Okay, and what we're proposing here is to move the primary responsibility from MDHA to
Yes.
Homelessness Commission?
Yes, because when we look at the staffing level that's available, we are already better positioned for that. We have been working extremely closely with MDHA throughout this entire year, and I think we've made a lot of progress. I have been upfront with the COC board, with our board. This is an intention. I'm going to put my head in there. We believe it's the right place to be. We already do a lot of the housing navigation is really the core piece of what a coordinated entry system is and the process that it takes to move people through the system from literal homelessness to housing. And we already, that's where we're doing the training. We're already having the staff to fulfill those functions. And we believe with agreement with MDHA, we're looking at HMS and coordinated entry system needs to be in one place. One of the things I'm really proud to say, this past year, we have been able to increase the HMAS usership through our all collaboration by 50%. There is the talk about HMS and using it and how useful it can be for the community from service providers has really increased. Service providers understand there's an investment needed. They want an investment. They're asking us for it.
So this would be the same players around the table here. We're just moving the operations and administration of the system to social services.
Yes. It will be more efficient.
Okay.
And that's what the $389,400 is for. And from our previous conversations, my recollection is that there had to be is this contingent upon a vote at the continuum of care?
Yes.
Yes.
My sense was there were two votes there that were going to take place. One sort of as recommendation, the second one as a final affirmation of that, and that second vote has not taken place yet. Is that right?
That's correct.
So would this funding increase be contingent upon that second vote taking place, or is it proceed regardless?
It really is, to a certain degree, contingent. I'm a strategist. I always have a plan B. So, but it is about transparency and allowing the community to decide. So we have to have that full conversation with the community, and that's what we're focusing on.
And at the bottom line, well, a bottom line behind doing this is that we are drawing down federal funds at a lower rate than comparable cities, and that we might invest $389,000 and get 2, 3, 5, 10 times as much back over the long haul.
Yes.
Is that right?
We're just not competitive right now as a city, as a community, not the city. But.
Well, I think we'll put this, high on the list of things we try to do in a status quo budget year. There's still work for us to do as we get the budget ready, but it seems like a high priority for the city.
Thank you.
That's it.
Thank you all very much. Oh, did you have anything else?
No, I'm good.
Okay, thank you.
Thank you.